Hi, this is Dr. Jenny Byrne. Welcome to our demo program of the CPCH Wellness Program. Today we're going to talk about sleep basics. So the first thing I want to talk about is sleep and your mental health. What is the relationship between the two? I think most people have a common sense understanding that if we don't have good sleep, it affects how we function. But exactly what are some of the changes that happen? So if we don't sleep well, it affects many things. So first of all, in people who have, normal kind of range of mood, they don't have a specific psychiatric diagnosis with mood, having sleep deprivation results in a more negative mood overall. So for anybody who's not sleeping well, you tend to get more irritable, more negative. Your thoughts tend to be more negative. So even in somebody who doesn't have a mood problem, sleep can really lead to an increased amount of negative mood and thoughts. Now, where it gets a little tricky is if you do have a history of problems with mood, sleep is really sensitive for you. So if you have had problems with something like major depressive disorder, which is an ongoing recurrent problem with depressive episodes. And a depressive episode, again, just as a reminder, is when you have at least 2 weeks of really severely impaired mood that is affecting your ability to function well, with symptoms like, changes in sleep, changes in appetites, low mood, low energy, increase in negative thoughts, hopelessness, worthlessness. Those are some of the symptoms of a major depressive episode. So poor sleep. So like, let's say that you have a period of time when you're working really hard, you're staying up until 2 in the morning and you're getting up at 6 and you're just not getting enough sleep. If you do this long enough, it can put you at a serious risk of relapse into having another major depressive episode. So that's something with our patients we're always really careful about, is to keep an eye on their sleep to help them stay mentally well and avoid having another depressive episode. For people who have had a diagnosis or problems with bipolar disorder, sleep is also very important. Poor sleep can increase the risk of relapse for both depression and for manic episodes. So if you are not getting a lot of sleep, it can trigger a manic episode. And again, manic episodes, often people are not sleeping well to begin with. Manic episodes can be characterized by a decreased need for sleep. So we know that sleep and mania are closely related. What about anxiety? If you have a history of anxiety problems, either panic disorder or generalized anxiety disorder, poor sleep can really drive anxiety. And for people with anxiety, it's kind of like a vicious cycle, because the more they don't sleep, the more they get anxious, and then they get anxious about not sleeping, and then that makes it hard to sleep, and then they get more anxious, and then they don't sleep, and you can see where it kind of goes around and around and around. Another really interesting thing about sleep is the impact it has on ADHD, or attention deficit hyperactivity disorder. There's a lot of evidence starting to come out now that people with ADHD may have a shifted sleep cycle. And in our next section, we're going to talk about that a little bit more. But if you do not have a regular sleep routine with ADHD, it really can make your concentration and focus worse the next day. So again, sleep affects mental health for everybody, but if you have a history of mental health or psychiatric diagnoses, it can really disrupt your ability to function. How about cognition? So for everybody, sleep deprivation impairs cognition. So again, cognition is kind of your brain's ability to think, to make decisions, to do complicated tasks. If you are sleep deprived, there's a lot of evidence showing that you have problems with attention, which all of us kind of have a sense of that, right? Your ability to focus and attend. Working memory. Working memory is when you have kind of a workspace in your brain where you put a lot of data and then you work on that data. So an example would be a phone number. If you need to remember a phone number, you would have to put those numbers into your working memory long enough for you to go to a phone and make the call. Of course, with cell phones, we don't do that quite as much, but that's just an example. Long-term memory, those are memories from your past. Decision making is a big one with sleep. If you are not sleeping well, it gets really hard to make decisions. You can get overwhelmed quite easily, feel very flustered. So sleep deprivation impacts cognition in a big way for everybody. How about physical health? You may have read, there's been some press around this recently, that sleep deprivation really impacts your physical health. It increases risk of things like obesity, diabetes, heart disease, high blood pressure, poor immune function, and even can decrease your life expectancy. So I think that's pretty major. What I have seen in working with my patients over the years, in particular, this poor immune function, I see a very, very strong relationship between the amount and quality of sleep people are getting and their immune system. So in other words, when they're sleep deprived, they tend to get sick more. And if you know anyone like a college student, this is a good example. College students stay up cramming for exams for a couple of weeks, and then what happens when they go home? Often then they crash and their immune system is impacted and they get sick. So getting sick either during exams or after exams for college students is really common. And a lot of that, I think, has to do with sleep, that they're not sleeping and they're impairing their ability of their body to fight infections. So these are just some things to think about why it's so important to take care of your sleep. And we're going to talk in the next section about a little bit about the biology of sleep. And then in the third section, we're going to talk a little bit about how you can start to understand your personal sleep and what you might want to do or take action on.